Hi, and welcome to another interview with a Texas candidate for Congress. With me today is Melissa McDonough. She is running for Congress in Texas' 38th Congressional District. Welcome to the show.
You, Amy, I appreciate it.
Well, before we get started, tell listeners where the 38th Congressional District is. What part of Texas that's in?
So 38 is all in Harris County, which is encompass Houston, Tomball, Katy, but we're on the northwest side. So we are from the Montgomery County line, past I-10, so the energy corridor, into 610 a little bit even, and then all the way back up through Spring. So it's a gerrymandered district, and you will need to go to the website to look to see if you are actually in the district.
All right, so good. They can go to your website. And where is your website?
So we've even put together a page where you can literally put in your address or your favorite restaurant and see what district it's in. So if you go to melissaforcongress.com/map, it's actually an interactive map that will work with Google even.
Oh, wonderful. That'll make it nice and easy because I know these Texas districts that they were bad enough with the 2020 census, but then the ones that came up in 21 were bad enough, but now they're extra gerrymandered
They
or
are
that
ridiculous. It's
little
just, I
extra.
mean, you literally have one block. We'll be carpool canvassing, and the street in front of us is not included, but the street just beyond it, if you go beyond the stop sign, is back in district. So we really have to use our mapping to figure out if your neighbor is even in the district with you or not.
Well, let's talk just a little bit about some of what you have been doing and some of what you can do for people who are in your district and for really all Americans. Because when you're in Congress, you're specifically representing your district, but in reality, you're making decisions for the entire country. So let's talk. I think one of the things that's really on people's mind is healthcare. Let's start there.
So I love starting at that spot because that's actually where I started actually volunteering and going to our capital. So in 2004, I have been a realtor and brokerage owner since 1995 is when I started my career. But in 2004, my niche group of clients were small business owners and they could not afford healthcare. It just wasn't an option for them because we didn't have big box competitive bargaining ability. And I kept seeing where they were unable to purchase a home or even purchase land to build their business on because of credit imperfections due to medical bills. And that was something that would never fall off their credit bureau. So they would never realize the dream of home ownership. When the National Association of Realtors said that they were going to go to the Hill as a group and advocate for a bill that would allow associations and organizations to be able to bid and have that bargaining power for health insurance, that was the answer. And I went with the National Association of Realtors to do that. It didn't pass that year, but the next year, when I brought that bill again, I went to a young senator's office, and his name was Barack Obama. And it took me a minute to figure out how to even say this man's name so that I would sound somewhat intelligent. But I proposed this bill and said, would you please help us get this passed? My clients really need this. And later, that bill did pass, and that became the foundation of what we know as ACA. That win and seeing how my clients were able to benefit from that, I have gone as part of our family budget since then. if not every year, every quarter, to help advocate and volunteer lobby for bills that work in affordable housing, affordable health care, consumer protection, building the CFPB, and then veteran services. And this year, working with farmers and working with food. Food is the foundation to healthcare. And so we build from there. And that has been exciting to be able to do that. And now, after 2 decades, running into people, even while canvassing or being in the community, that have benefit from those bills that I never knew how it would really help in the end or who it would really help. But to hear their testimonies now come back, saying that, that initial bill helped a very young lawyer who just passed the bar that was pregnant get out of a domestic abuse relationship because the Bar Association now had that healthcare ability. She was able to leave her abuser, and she's a judge here in Harris County now. I mean, it's amazing. And her child is in college. Those are the stories that make what we do, not only as volunteers, but specifically what we do as a Congress, how it affects people's daily lives, makes it so valuable.
Let me ask you, a big buzzword on the left is Medicare for all or universal health care. How can we get there? Is it possible? What's the path forward on that?
Is it possible? Absolutely. Is it tangible in a timeline in the next 2 years? That's not realistic. I want us as a country to be able to provide health care, food, housing, as much as we can afford for everyone, regardless of economic status, regardless of where you live, regardless of religion, just a pathway for people to have basic needs fulfilled, which is food, which is health care, and is shelter. Um, we need to do a better job. We don't take care of our children, our elders, and our vets the way we should.
And so obviously, as long as Trump's in the White House, we're not going to be able to get the things that we want. Um, but
Being honest, as long as not only Trump's in the White House, but Steve Miller's in the White House and Russell Vaughn is the OMB, we are not going to get anything that we need.
right, and my concern is that we um we have some really crazy people in charge of healthcare right now.
The experts are whom? They are the people who earn the degree, that have taken the exams, and most importantly, taken an oath. And for some reason, they're not the ones in charge. That is, it's unexplainable. I don't know how we got here. But moving back to that being those are the people, those are the professionals that we listen to, that is something that we can do very easily and very quickly if we have a Congress that really has a spine and takes the power of the purse and the power that they're supposed to be wielding back in check to check the administrative. I mean, that's the whole reason for Congress is to be a balance and check. And we're not doing that at all.
There's a big problem right now with these epidemics that are coming back. These
Like measles.
measles and whooping cough is another one that's
Hmm.
coming back. There are these diseases that we had gotten control of
Hmm.
that are back being a problem. And I hate to say it, but even on our side of the aisle, there are some folks that um, don't believe in the science. My father was a pediatrician, and he went to Vietnam and during the war and worked in a hospital. And the thing that distressed him most was there were children dying from diseases that we had wiped out with vaccines.
Yes, that we had eradicated. And that was one of the wonderful soft powers that we had with USAID. We were able to go into countries before food or people transported to the US, even to visit. And we were able to assist with that by using food as a power, as a soft power, to be in those areas and to assist bring vaccinations, but bring the right ones and making sure that we were knowledgeable, not just on what was going on in the US, but what was going on globally. And that impact has now dissolved. And that was a wonderful soft power that allowed us um, to really connect with other countries on a ground, boots on the ground level. That is, it's sad that that's gone, but more importantly, it's a security issue. And that is one of the first things the next Congress, the 120th, really needs to focus on.
All right, so I think we have what your goals are when we get back control of hopefully the House and the Senate, but certainly the House. Uh, Priorities in the arena of health. Let's just get your wrap up, and then we're gonna um, end this particular segment.
Well, I think we have to divide the new Congress into probably about five different groups based on the new Congress's experience, each congressman being divided up. So in for of healthcare, we're going to need to have a group that focuses on nothing but accessibility, funding, and advanced care. So that's going to have to be a group all by itself that really just concentrates on that. I think we need another group that's going to work on housing. That is the bones of our economy. And we need some new housing, what I say products. So finance products, which I have some ideas on, so that we can get housing really jump started and affordable, get people into housing. We need a judicial group that is going to work on the judicial area of Congress being able to have that power and be able to do those checks and balances. We're going to need a group that's going to have to work on our global economy and our global relationships. We have imploded them through tariff wars and through, USAID and being removed from WHO and so forth. So you're going to have a group that just really concentrates on that in order to find a path forward. This is not a quick fix. What we have done is we've thrown out the baby with the bathwater instead of going in with a surgical, scalpel and really cutting through things that really needed to be removed. We just did away with it. I mean, the education department is pretty much gone. The Consumer Federal Protection Bureau that I assisted on, creating has less than 200 employees now. Those things all have to be put back together, but in a way that advances forward. We're not going to be able to go back. We have to advance forward with our initiatives, and that's going to take time. It's not going to be in one Congress session. This is going to take a couple of times around to be able to get to where we really see advantage with that.
All right, well, thank you so much. Uh, I look forward to speaking to you again in the very near future. Once again, you are Melissa McDonough and you're running for Congressional District 38. And your website is?
MelissaForCongress.com.
All right, thank you again, Melissa.